Hello, this is Matt Clarkin with Access Point HSA, and this is a CHSA update for July 22nd, 2020. In this CHSA update, we're going to take a look at a survey that was published last week by the JAMA Network Open, which is a part of the American Medical Association. The goal of this survey, this study, was to determine which patients who may be eligible for a health savings account do not have one, and what decisions patients with HSAs make about contributing to them. In this JAMA survey, they surveyed 1,637 individuals who were HSA eligible. So these are people who were covered under HSA eligible high deductible health plans. And here you see a breakdown of those 1,600 individuals with regards to age, female versus male, and level of education. So when it comes to HSA ownership, here's what the survey found. 58% of people surveyed owned an HSA. 33%, a third, did not own a health savings account, even though they were HSA eligible. So they're covered under a high deductible health plan, but they don't have the HSA to go with it, which is a total lost opportunity. On top of that, 9% of the individuals who were part of the survey didn't even know if they had a health savings account. So as we break down that percentage, those survey results, we look at the source of the health plan. When we look at those who had their health plan through an employer that offered only one health plan, so they only offered a high deductible health plan, 36.5% of those individuals did not own a health savings account. Now, those who worked for an employer who offered some options with regards to the health plan, so not just the high deductible, we saw 21.5% not have an HSA. So those who actually chose the chose the high deductible health plan had a higher percentage of actually opening the HSA. And then the real lost opportunity is for those who are actually purchasing their health coverage through one of the Affordable Care Act private health insurance exchanges. 70%, over 70% of the people who received their health plan through one of the Affordable Care Act exchanges do not have a health savings account to go with that high deductible health plan. Looking at education, it seems that level of education does have an impact with regards to opening an HSA. 40% of those with a high school degree or less did not have a HSA tied to the high deductible health plan, while a little over 22% of those who have a master's degree or higher did not have a health savings account, even though they were eligible through that high deductible health plan. Income, according to the survey, did not seem to make a difference. There wasn't much of a difference when it came to the survey. So we can look at these numbers and say, boy, that's really negative and that's really poor. And it is in many ways, but it's a real opportunity as well. It's an opportunity for the advisor to assist the employer and the employees when it comes to better understanding the HSA, which is something we've been talking about for 5.5 years. And I know you've all listened to through the CHSA program. In the next CHSA update, which will come out on Friday, we'll take a look at the second part of the JAMA survey, which takes a look at contribution amounts and also makes recommendations on how we can improve those who are not opening HSAs, how we can improve those numbers and also improve the level of contributions by HSA owners. If you have any questions regarding this CHSA update, or if you have any suggestions for other CHSA updates, please let us know at info@accesspointhsa.com. Thanks for your time.